Good morning, everyone. Happy to see the hall absolutely full. My only regret is that we are not able to provide enough chairs for all of you. Most meetings have the other problem.
So there is a
all the
hall.
chairs are there, but no people.
So is there a spillover hall there?
So that's what I wanted to say. That those of you who are standing and would like to take a seat, there are 2 spillover halls. So please go there and you can listen to the same thing. You don't have to keep standing all the time. So, good morning everyone, and I'm very happy that we are taking up topics which are generally not discussed. And we think that, oh, functional foods are all bogus. This is the first thing that we think of as allopathic doctors. One of the things that we have is we have a bias. We think only medicines work, only what. But there are so many other natural supplements which you completely forget about. So, Anuj, fantastic talk. Congratulations on that. I'm going to touch on another topic, which I don't know why, but for the last 30 years, the moment you say artificial sweeteners or alternate sweeteners or sugar substitutes as we call them now, somehow it has got into the brain of people that's really bad. Okay? This came from when I was doing my medical studies, that thing on saccharin came. And saccharin is supposed to have produced cancer in mice. Now, the dose which is given us 2,000 times the human dose, 2,000 times. Mice are so small. So, you can imagine the bladder of that mice, how small it will be. If you hit it with 2,000 times, mice develop bladder cancer with anything. You give them not only sweetener, you can give them anything, and they'll develop cancer. And as we heard yesterday, many speakers saying mice are not humans. I was waiting for one study to show in the last 30 years that there is any link to cancer, and has never ever been shown in any study. But even today when you talk to people, they say, oh, it produces cancer, no, because of that one study. US was the one which banned saccharin, and then after 15 years they said, oh, it's good, you can take it, but by the time damage is done. The other thing that they think is that all sweeteners are the same. They are not the same. So let me show you a balanced approach, because we've done work on it, and that's why we'd like to present. Like to thank, first of all, Zydus Wellness for supporting these studies. They had no role in the study design, conduct, analysis, or publication of the results. They only funded the study. And we always tell our sponsors that if the study comes out negative, we'll still publish it. That's a risk you're taking with us. And so, luckily, the results have not bad, and I'm going to show you. And I'd also like to thank Dr. Shilpa Bhupathiraju and Dr. Daniel Haslam for helping us with designing these studies. So, sugar consumption. India is the largest producer and consumer of sugar in the world. It's not China, it's we. And so, it's the second largest producer, but the largest consumer of sugar in the world. So, WHO says less than 5% of added sugars should be taken, but yesterday you saw the results which Dr. Anjana presented. Not one state in this country has less than 5%. Dr. Narula, why don't you come to the front? There's a seat here. Dr. Narula, please come to the front. There's a seat here. Why are you standing? Come. There have been some concerns, and I'll come to you why those concerns have been there. But in India, the consumption of these sweeteners is not in the colas, the soft drinks having a lot of it. That's more a US phenomenon than a Europe phenomenon. We don't take it that way. What we take is with coffee and tea. We take a little bit, 1 drop or 1 tablet or a small portion. That is what we do. Believe it or not, there was no study which has actually looked at whether that is safe or not. We are shocked when we found there's not a single study which has looked at it, because people are only looking at the large consumption in the colas. So, sweeteners you can broadly classify into nutritive sweeteners and non-nutritive sweeteners. To start with, for people with diabetes, we are not talking about nutritive sweeteners. We are not talking about sucrose, fructose, dextrose. They are all our things like that, which add calories. So, we don't want them to add calories. And so, the nutritive sweeteners, we are not even talking about them. We are not even talking about the sugar alcohols. We are talking about non-nutritive sweeteners, also called as NNS. And there are many of them. There's aspartame, there's neotame, there's saccharin, there's cyclamates, there's stevia, and the sucralose, and so on. We don't have all of them in India. We have 2 or 3 of them in India. Now, whichever one you take, I'm only going to talk about non-nutritive sweeteners because we don't recommend nutritive sweeteners at all. So, these are old drugs. Some of them are like saccharin is like 1879 it was found out. Stevia is also quite an old one. Certain things like sucralose and so on are more recent, 1976. Neotame is even later. Now, the thing about these non-nutritive sweeteners is that they are not sugar, and yet, believe it or not, they are much more sweeter than sugar. Can you imagine something being sweeter than sugar? And that's the reason why a small portion of it is sufficient. It will be 100 times sweeter, 50 times sweeter, and so on and so forth. So you can see the relative sweetness of sucrose, 600 times sweeter, 1000 times sweeter. It's like that. So these are compounds that are intensely sweet tasting. So it deceives the brain to think it's sugar, but it's really actually not sugar. Sucralose is the one I'm going to talk about. That's the one which we have done the work on. So we've not done work on all the sweeteners. We've done on sucralose. It's actually a derivative of sucrose. So you can see the difference. I'm not going to go into it. So the difference between sucrose and sucralose is shown here. But actually it is 600 times sweeter than sucrose itself. Sucrose we think is sugar, and that's the sweetest you think of. This one is 600 times sweeter than sucrose itself. That means you can take, and it's 0 calories. Sucrose has some calories. Sucralose is 0 calories. So if you take that, you're not going to get calories at all. Now, this advisory came from the WHO on the non-nutritive sweeteners in 2023. And when this came, it kind of shook the world, because they said not to use non-sugar substitutes for weight control. Now, if you look at the underlined statement there, which many people miss, what they're saying is the recommendation applies to all people except individuals with pre-existing diabetes. So they have clearly said that our advisory is not for people with diabetes. So we are treating people with diabetes, so it doesn't even apply. Okay? But when headlines come, they don't show this at all. They'll say WHO says it's bad, don't take it. And why WHO is saying it? Because they say the consumption of these non-nutritive sweeteners is very, very high. It's huge. They keep, instead of water, they keep just drinking diet colas. Thinking 0 calories, 0 calories, 0 calories. A lot of this goes into the body, and it does produce some changes. In fact, what they found is that actually the weight goes up. Even though it may not have calories at all, actually the weight goes up. And they also showed that the sugar can also go up. Okay, more than your sugar consumption. So they said, okay, people without diabetes, don't try to take this to reduce weight. You're not going to reduce weight. That's all they said. And of course, 1 or 2 of those, erythritol and 1 of those, produce strokes, and so they did have some side effect. Those don't exist in India. We don't use them at all. Okay, and that too mostly in animal studies. There are very few human studies on them. Okay, so at around that time, before the WHO advisory came, we had already started our studies, not knowing the WHO is going to do it. We said we should just test it. So we took up 2 studies, in fact 3. There are only 2 I'm presenting here. One is in those with type 2 diabetes, and the other is with obesity and overweight without diabetes. We wanted to study the diabetic group and the non-diabetic group. So, and these are published in reputed journals. As you can see, it's been peer reviewed and published. It's a proper randomized clinical trial. So what did we do? In study 1, what we did was, we didn't take, it's not ethical to take people with diabetes and say, you take sugar and you don't take sugar. We took those who already taking sugar, okay, and said, okay, you continue your sugar. You're already taking it. We are not asking you to stop it. You continue it. The other group, we said, can you give up sugar and we'll give you sweetener. So there's no ethical issue here, okay. And then we said over 3 months, please try not to take sugar for 3 months and we'll give you this. And we had stringent ways of monitoring it and seeing that they actually took it. We measured many things to make sure that they actually took it and so on. So 12-week randomized control trial. We measured body weight, BMI, fasting, waist circumference, fasting glucose, HbA1c, cholesterol, HDL, LDL, triglyceride, everything we measured. We've done a lot of other studies. Some of it I'm presenting here. So that's the design. We have 2 groups. One group is a control group where they continue to take 88 patients who continue to take sugar, small quantities. In the tea and coffee, they continued sugar. That's it. You're not telling them take extra sugar. whatever you're taking tea and coffee, you're already taking with sugar, you're refusing to give it up, you continue it. We'll see what happens to you. And this group will say, okay, we are now 91 of them. So what did we find? What we found that was in the intervention group, there was a small weight reduction, okay, because the amount of calories that you're replacing, remember, it's only 1 or 2 spoons of sugar that they're taking. So it's not huge amount. These are 0 calories. So a little bit of calorie restriction, only about 50, 60 calories a day, which you're reducing. But even with that, in a 12-week period, slight reduction in the weight, no change in the control group, if at all 0.2 increased in the control group. So if you look at the adjusted difference, it's 0.3 and it becomes statistically significant. So even with this small replacement of just 60 calories per day, there's a slight decrease. So if you extend it, probably you will get more. Waist circumference, again we found no change in the control group, and in the intervention group, there was about 1 centimeter reduction, 0.9 centimeter reduction in the control group, and this was highly significant statistically. So a 1 centimeter reduction just by replacing coffee and tea, the sugar, with a sweetener. Fasting glucose and HbA1c in the control group 161, 163, in the sweetener group 155 to 152, 3 milligram reduction didn't reach statistical significance. But the point is, it didn't increase the sugar. What WHO is saying is it can increase the sugar. So it didn't increase the sugar. If at all, there's a decrease in the sugar. HbA1c, again, there was no change. It's only a 3-month study. With a small calorie thing, so almost the same. So there's no change in, so at least it didn't increase. That way we can say, didn't decrease it that much. So just by stopping sugar, that's the other thing we learned. Just by stopping sugar and switching over, you're not going to get much improvement in your A1C, okay? So replacing sugar with sucralose-based tabletop sweetener and 3 cups of coffee and tea can cut 60 calories per day. It's very simple. The maths is 5 grams. So you have 3 times a day, 2 spoons. You do the maths, it will come to about 60 calories. So you may say 60 calories, does it really make any difference at all? Okay. So here is data where we looked at what actually happens over a long period of time. Does this lead to a decreased calorie? Carbohydrate, yesterday remember for Anjana's talk, she talked about carbohydrate, she talked about glycemic load, glycemic index and so on. So there was a significant reduction in the total energy, total calories, in the carbohydrate, in the glycemic index as well as in the glycemic load. Naturally, you're replacing sugar with a non-sugar substitute. So over a period of time, you're able to reduce the glycemic index and glycemic load, which is a very problem we have in Indian diet. So already we have a lot of rice and so on. We've not changed all that, by the way. We only cut out sugar. If we had reduced a little bit of rice also, then we'd have had tremendous, but that is not the aim of the study. The aim of the study is only to replace this with that. So the question is, can this minor caloric deficit drive health benefits on a long-term basis? This is not our study, but there is the effect of this has been studied in the UK, and it has been shown that it can actually reduce obesity by 5.5% in adolescents, in adults. So even small reductions in calories, if it is sustained over a period of time, it can help in reducing obesity rates on a population basis. And this is a UK-based study. The next study that I want to talk about is the effect on obesity and overweight people. So these are people who don't have diabetes, and we wanted to check what happens to them, because what WHO said was that if you take too much of it, your sugar will actually go up, your weight will go up. So we wanted to study in non-diabetic people. The same thing we repeated for all of them, same study design. So we have a control group, and we have 101 people in the control group and 97 people in the intervention group. Again, after 12 weeks, we studied. So what did we find? So we find that there is a change in the body weight. In the control group, it actually went up, and the intervention group, it came down, and the BMI also decreased in the intervention group, and this was statistically significant. So even in non-diabetic people, small reductions in calories over a 3-month period can help in reducing the BMI. Waist circumference, even better than in people with diabetes. In the control group, no change at all. In the intervention group, a 1.2 centimeter reduction in waist thing, which we know in Indians, central obesity is a big problem. These are people without diabetes. No change in physical activity or no change in calories. They didn't change anything else they ate. The only change was this. So this is highly significant statistically, that a waist actually comes down. What WHO had said was about huge consumption of NNS. We have not done that. We are not even contesting that. And they said it's not for diabetic people. We are more interested in people with diabetes. So we didn't look at that. We wanted to see, this is how Indians consume it. What happens? Is it good or bad? Fasting blood sugar, interestingly enough, in people without diabetes, there's a significant reduction in fasting glucose. Okay. Maybe in people with diabetes, they're already taking medication, they're already taking this, taking that. We're not able to see that big change. But here, we are actually saying a decrease in blood glucose because we're replacing sugar with a non-sugar item. So we are able to see that. HbA1c, again there, remember, we didn't see any change in HbA1c. In non-diabetic people, we're able to see a small change in HbA1c. So maybe for people with pre-diabetes or at-risk people, it's actually a good way to start. Start stopping your sugar and changing to something else. Insulin resistance. HOMA-IR, remember the waist came down. So when you looked at the HOMA insulin resistance, it actually went up slightly in the control group, quite significantly came down when you cut off sugar, because sugar is obviously producing insulin resistance. For those of you who listened to Dr. Arun Sanyal yesterday, he was talking about insulin resistance being the primary thing which then leads on to MASLD and then leads to heart disease. And we have Dr. Jagat Narulla today. He's going to talk about similar things later today. So a significant improvement in insulin resistance, and insulin resistance is a primary cause of the Asian Indian phenotype which we know, which leads later to beta cell dysfunction. If you want to prevent diabetes, is a good way to start. HDL cholesterol. Now we all know that our HDL, we have the, I hope you know, that we have the lowest good cholesterol or HDL cholesterol in any ethnic group in the whole world. It's lower than Chinese, Japanese, white Europeans, you black people, you study any population, we have the lowest. That's a South Asian phenotype. How to increase it? Now we are not great exercisers. We are not big Olympic champions, as you know. So one of the ways to do it is to cut your carbs and to cut your sugar. And you can see that there is a small increase in the control group, no change, but the HDL actually going up by 2 milligrams just by cutting sugar and replacing it with thing. And look at the triglyceride reduction, quite significant, because sugar is linked to triglycerides. We know that. That's what leads to fatty liver. So you're getting more than one benefit. We are not measured FibroScan, we are not measured other things, but we are beginning to see that there is a benefit in stopping sugar. We also looked at the total cholesterol by HDL ratio, and this ratio favorably improved. It worsened in the control group, and it favorably improved in the intervention group. So we also collated literature, because we looked at the literature on the metabolic outcomes, and there are 26 RCTs, a meta-analysis of 26 RCTs, which shows no acute impact of the nutritive sweeteners on glycemic parameters. You have to take really huge amounts of nutritive sweeteners to get some bad effect. So in healthy people, type 2 diabetic people, here is a meta-analysis which is showing you that it's not bad. I actually opposed the WHO when they said that and said, you've got so many other things to do. Why are you bothered about small consumption of nutritive sweeteners? Frightened everybody in the world. As they're going to get cancer or they're going to get something. These poor people are just replacing little sugar with a little small amount of nutritive sweeteners. I actually wrote to them and said, you've got other things to do, bigger problems. Forget about nutritive sweeteners and don't waste your time too much on that. So here is another 36 trials, meta-analysis, which shows that whichever way you take it, they have no acute metabolic or endocrine effects. And also remember, it is dependent on which sweetener. Again, I'm telling you, erythritol, and 1 or 2 of those have been shown to bad. I don't think any study has shown that sucralose is bad. Even in the studies you studied, all of them, sucralose comes out to be beneficial. So you have to choose which sweetener that you're taking as well. Stevia and sucralose seem to be different from the other nutritive sweeteners. Here again, it's another meta-analysis of 14 prospective studies which shows no association with any cardiometabolic outcome. Here's another meta-analysis of 60 trials which looks at and they show that they are actually safe and effective. Weight loss and calorie reduction is seen when sugar is substituted with sweeteners, and there are many, many studies. So it's not just our study which is showing that, many studies which show that. So in conclusion, I'm not showing you the effects on gut microbiota because they're still under publication. We're just writing that up. So that's the other thing that they say. When you take nutritive sweeteners, your gut microbiota is completely changed. Well, that's not completely true because we have done it both in people with diabetes and without diabetes, and there are some minor changes there, but it's nothing to worry, and we're getting that paper also ready. So in summary, ladies and gentlemen, the way we take non-nutritive sweeteners in India, replacing coffee or tea, the little bit of sugar that we put in it with a non-nutritive sweetener, is not only safe, not only doesn't have any bad effects, but probably has a host of beneficial effects. And therefore, all of you can stop sugar from today. Thank you.